Gonorrhea, a public service announcement by Ty Laverne. What is gonorrhea? Gonorrhea is a sexually transmitted disease, or an STD, also known as the clap, caused by an infection of a bacteria known as Neisseria gonorrhea bacterium. N. gonorrhea infects the mucous membranes of the reproductive tract. In women, this includes the cervix, uterus, urethra, and fallopian tubes. In men, it can affect the urethra. It can also infect other mucous membranes of the body like the mouth, throat, eyes, and anus. What causes gonorrhea? The bacterium Neisseria gonorrhea infects the mucous membranes of the reproductive tract, oral cavity, and rectum. How do you contract gonorrhea? Gonorrhea is spread through direct person-to-person contact. It is almost always transmitted through sexual contact, though it can also be spread from mother to baby during childbirth. How can you prevent gonorrhea? When used correctly and consistently, latex condoms can reduce the risk of transmission of gonorrhea. However, the only guarantee to avoid contracting gonorrhea or any other STD is abstaining from sexual intercourse completely. Symptoms of gonorrhea. Many people with gonorrhea are asymptomatic or show no signs or symptoms. When men show signs of gonorrhea, they generally include white, yellow, or green discharge from the urethra. In more severe cases, men with gonorrhea may also complain of testicular or scrotal pain. When women show symptoms, they are often mild and mistaken for bladder or vaginal infection. Initial signs in women include increased vaginal discharge or vaginal bleeding between periods. Symptoms of rectal infection in both men and women may include discharge, anal itching, soreness, bleeding, or painful bowel movements. Untreated gonorrhea can cause serious and permanent health problems in both men and women, specifically infertility. If left untreated, gonorrhea can also spread to the blood and can be life-threatening. Who should be tested for gonorrhea? Any sexually active person can be infected with gonorrhea. Anyone with genital symptoms such as discharge, burning during urination, unusual sores, or rash should stop having sex and see a healthcare professional immediately. If you learn that any of your past sexual partners has been diagnosed with gonorrhea or any other sexually transmitted disease, you should be tested. Some people should be tested for gonorrhea even if they do not have symptoms or know of a sex partner who has gonorrhea. People who have gonorrhea should also be tested for other STDs. Treatment for gonorrhea. Gonorrhea can be cured with the right treatment. The Center for Disease Control recommends dual therapy or treatment with multiple drugs. It is important to take all of the medication prescribed to cure gonorrhea. Medication for gonorrhea should not be shared with anyone. Although medication will stop the infection, it will not repair any permanent damage done by the disease prior to treatment. If a person's symptoms continue for more than a few days after receiving treatment, he or she should return to a healthcare professional to be reevaluated. National occurrences of gonorrhea. Gonorrhea in Louisiana. Louisiana is the second highest in the country for rates of gonorrhea, an average of 204 individuals a year. During 2010, there were 8,912 cases of gonorrhea reported, a 3.5% decrease from 2009. Females between 15 and 19 years old had the highest gonorrhea rate, followed by 20 to 24-year-old females, and then 20 to 24-year-old males. Gonorrhea in Lafayette Parish. 375 cases, an average of 169 people per 100,000 in the population.